welcome back to my channel. And today I'm going to be talking about why dental assisting might not be right for you if you're looking into getting into the dental field at all. So yeah, let's get to it. All right, so first off, being a dental assistant comes with having to be very friendly and not shy. I would have to say that because you meet a lot of people and a lot of people are afraid to go to the dentist. So if you are a very shy person and you don't really like to make conversation with people, that is going to be really hard for people to open up to you. And that's kind of the point of dental assisting, being a dental assistant, is to have patients be able to connect with you in order for them to have a great experience, really. And I say that because you meet a lot of people and they just don't really like the dentist. So if you are very friendly and talkative and make them feel like, okay, maybe I'll try it out, or maybe I should face my fears, and get it out the way, then they're more likely to come back. And that's what you always want. You want the patient to come back and get all the work done so they can be on a healthy track. And also, with that being said, there's a lot of, I wouldn't say mean people, but mean people if they're going in just for an emergency to the dentist and they're most likely in a lot of pain. People kind of wait to the last minute and to get the job done. I don't know why we do that, but they always just push it off until the last minute. But yeah, so if someone's already coming in cranky because they're in pain, they're swelling or whatever, and they don't want to hear nothing that you have to say, even if you're the most friendliest person, they don't care. Like, they just want to get one thing done. If you take whatever they say to the heart, then this job might not be for you, because then you're going to be sad all the time because you have a lot of emergencies and you have to just kind of help the patient and just kind of deal with it. Honestly, I get a lot of that sometimes, and I'm like, either way, if you don't like me, I'm going to get you to like me by the end of this visit, like hands down. And especially if you do same day treatment, if the doctor does same day treatment and you've been like very helpful, let's say it has to be an extraction and we do the extraction the same day, they're gonna appreciate how kind and, I guess you could say, loving you were towards them after the tooth is out, because they know that it'll only get better from there. So that's what you got to keep in mind too. Even if they're mean to you, you got to be nice to them. And that's just what it is. That's dental assisting for you. Also, if you don't mind running with your head cut off most of the time or doing a bunch of things at once, if you can't be a multitasker, this is not the job for you. Dental assistants play a huge role in the dental office because they're the backbone of the office, really. The dentist does the work, but putting the whole room together, being that assistant for the doctor and whatever else anyone else needs questions answered, you are the person they're going to go to. You can be doing an extraction, walking out the room to go get an instrument, and the front desk girl needs a quick question, so you gotta be like, boom, boom, I'm gonna get this, I'm gonna come back, I'm gonna help you. And the hygienist needs a quick fix, you gotta go help the hygienist real quick if you have time. If not, someone else got to do it, but it's still the dental assistant. Like, you're on your feet most of the time, and that's kind of overwhelming most of the time. But if you got multitasking down packed, you're gonna be fine. And for the people who actually like doing a lot at once, it's actually fun. I love productive days. I love doing a lot, unless like things go wrong. Like, there's times where everything's going wrong in the office. Those are one of the stressful days, but there's always a better day, so you can't let that day get you down. And also, yeah, if you're not a friendly person, this is just really not the job for you. Let's see, I'm trying to think of other stuff. Oh, if you do not like blood mixed with pus, this is not for you. You're gonna see a lot of that, especially with people who have huge infections in their gums. If you touch it with an instrument, it will bleed. If they have an abscess outside the gum that you can see, if they push on it, it will squirt out, kind of like, or ooze out, which is really gross to see. and saliva mixed with saliva. It's gross to talk about, but like when you see it, sometimes it's cool, which is a good thing. If you think it's cool, like you're gonna be fine in this job. But if you are really grossed out and easily like a gagger, you got to go, boo boo, because this is not gonna work for you. You see a lot of saliva like with everything. As soon as you look in your mouth, there it is. And most importantly, bad odor. People who are not really good on their hygiene, it doesn't really smell good. Like even through the mask, there's times where you smell the worst smells. It gets really gross sometimes, but you just gotta keep your head back. And then like if you're sectioning, just section from afar, because you got about an hour to do the procedure. Yeah, those are the real main things I would say. And I would say people, like we had this patient, and this was like the grossest thing I dealt with too. He was like the grossest patient. I say that because snot, that's really gross, but it triggers me sometimes. And like these people rarely come in, I feel like, but when you're doing a procedure and you tell them to close on a suction just to like spit all the water that's in their mouth out. But there was this patient who he would like and like get all his boogers and then spit it all out. And then if you take out the suction, if it didn't suction at all, you just see like a string. It's just so gross. It's just string connected to the suction from his mouth. And that's what's like the really grossest part ever. So if you can't handle that stuff, then I suggest you find another career. But yeah, because saliva is really gross, especially in dentures. If you're taking out a denture, a lot of the saliva is inside of the denture. So like you pull it off and then you kind of got to like scoop it up before it like drips anywhere on the patient or you, whatever. It's a good thing you have gloves, right? But yeah, I would say that's the main aspects of dental assisting that could kind of gross people out or like get people to kind of stray away from dental assisting. I'm not saying it's a bad job. I love being a dental assistant. I love making people feel good and making people comfortable, because that's the best part. If you can make someone laugh, I love making people laugh. So if you can make them laugh, hey, like it's a good day. It's gonna be a good day. But yeah, that's pretty much it. I hope you guys enjoyed this video. If you have any other suggestions of what you want to know about the dental field, let me know. Drop in the comments, put a like to let me know if I'm giving good feedback. If not, it is what it is. I'm gonna keep making videos. So have a great day. Peace.